cost is being missed?
And charges. I have to say, if you want to read some of the articles that I've assembled for this evening session, you can take a page from over there or we'll email them to you. But it is true, we have costs and charges that are out of whack. So it's both an issue of what is the unit price and how many units are we putting through the system. In the United States, we have every type of irrational sort of underutilization and overutilization of services, which exacerbates this problem. And no one's got a clear-cut solution to it. This act tries to move us away from fee-for-service, which is partly the culprit, but there's no silver bullet here.
So if I could just compliment what Maura had just said, there's actually many sectors. There's Title III of the Act actually addresses costs in a fairly substantive way. In addition to payment changes, it also promotes accountable care organizations. It promotes integrated delivery systems, which we really don't have in Connecticut, but some exist. Dartmouth-Hitchcock in New Hampshire, Geisinger in Pennsylvania, the Cleveland Clinic in Cleveland, University of Michigan in Ann Arbor, the Mayo Clinic in Minnesota. There's a number of these very sophisticated integrated delivery systems which coordinate both primary and specialty care in a way that have proven to be much more cost effective. So if you look at their PM per member per month costs, they're actually going down. So there's actually more substance than I think a lot of people recognize in the law. People focus on the stuff they understand the most, which is maybe the part that interests you maybe the least, but it's coverage and premium cost. But there are 9 titles in the law, and one is pretty substantive on cost.
Could I just add to that? I worked for a number of years as an executive with one of those integrated delivery systems, and if life had been different, I would have been a lifer with them. I have great affection and respect for the Kaiser Permanente organization, but that model should have been able to undercut the market enormously. And any organization, even a nonprofit healthcare organization full of people who want to do good works, in our situation, I can tell you, we could cut days per thousand, which we did, taking enormous amounts of money out of what we were paying hospitals. But you've got all of these other stakeholders, employees, pay me more, give me more vacation days, add to my pension. So I think that's a much better model than fee-for-service, no question. But some of the impact we need to have in the future is probably spending money outside of the healthcare system to reduce costs in the healthcare system.
I had a follow-up question related to costs and pricing. We are an individual plan. I look at the bills when they come in, and I notice that the price negotiated between the insurance company and the provider is typically a half of the list price for a given service. Help me understand why that price isn't going to go up. Where's the incentive for the insurance company to keep negotiating lower special rates for their